Let's draw a quick reminder of what's going on in Kawasaki disease. And to do that, we'll go ahead and draw this Kawasaki man, and we'll go ahead and label some symptoms that he has. First of all, remember that in Kawasaki disease, patients will have conjunctivitis. Remember, that's just red eyes. Next, you might also see a rash. Patients will come in with a rash that's diffuse over their body. It can be found on their chest, on their back, on their abdomen, or anywhere else. Patients also had adenopathy, and this is another word for swollen lymph nodes. So adenopathy is swollen lymph nodes. Particularly in Kawasaki disease, this is cervical lymph nodes. And cervical means neck. Remember, Kawasaki's other name was mucocutaneous lymph node syndrome. And so here we have lymph nodes affected. Next, patients may have something called a strawberry tongue. And this essentially, you take a look in the mouth and you see it's all very swollen. And if the patient sticks out their tongue, it kind of looks like a strawberry. Patients may also have rashes on their hands. And you may also see them get it on the soles of their feet as well. Now, this isn't just any type of rash. This is known as a desquamating rash. Desquamating means you're losing squamous cells. Your skin is made of squamous cell epithelium. And so what you're seeing is desquamation. Skin will start to peel off from the hands and the soles of the feet. And last of all, you'll see patients with a fever. They'll actually be burning up. Remember, this is a fever for more than 5 days. So when I ride my Kawasaki motorcycle, I'm actually not very good at driving, so I'm likely to crash and burn. And it turns out this is how you diagnose Kawasaki disease. If a patient has at least 4 out of 5 of these crash symptoms, along with a fever that's lasted for more than 5 days, this is enough for the diagnosis of Kawasaki disease. Now, why do we choose 4 out of 5? Well, this is actually to be more confident that we're making the right diagnosis of Kawasaki disease. So, for example, a patient with maybe only 3 out of the 5 symptoms might actually have another illness. Well, let me give you actually a very specific example of streptococcal infections. Children, which are the primary demographic of Kawasaki disease, are commonly affected by many different illnesses, as you know, bacteria, viral, and so they may actually get a streptococcal infection. Streptococcus has actually been known to cause rash of the body, a strawberry tongue, as well as a desquamating rash on the hands and the soles of the feet. And so look, we already have 3 out of the 5 symptoms. So with 4 symptoms, you can be more confident in diagnosing Kawasaki disease. So does this mean when you have less than 4 symptoms, it's not Kawasaki disease? No, not all patients who have Kawasaki disease have 4 out of the 5 symptoms. And in this case, it's known as atypical or incomplete Kawasaki disease. In a disease that uses clinical symptoms to diagnose, and we don't fulfill the clinical symptoms, how can we diagnose atypical or incomplete Kawasaki disease? Well, you'll actually have to take a look at some of the lab tests. If you're still suspecting Kawasaki disease, and you've ruled out all other possible infections or diseases, the next step you'll want to do is get an ESR, which stands for erythrocyte sedimentation rate, or CRP, which stands for C-reactive protein. Both of these blood tests are actually signs of inflammation. And remember, what is Kawasaki disease? It's a vasculitis. And what is vasculitis? It's blood vessel inflammation caused by the immune system. So by picking up an ESR and a CRP, since they are very sensitive tests, it's the first step to show that you have inflammation. So ESR should be elevated, which should be around somewhere above 40 millimeters per hour. And CRP, when it's elevated, it can be anywhere above 3 milligrams per deciliter. And if ESR or CRP, signs of inflammation, are elevated, your next step is to double check this. And you do this with supplemental labs. Now these supplemental labs include an elevated ALT, elevated platelets, elevated white blood cells, in either your urine or your blood, and decreased albumin. So these are, I wouldn't look into the specifics of this too much, but what you should know about this is that greater than or equal to 3 supplemental labs will lead you to the diagnosis of atypical Kawasaki disease. So then in this case, you start treatment. Now what happens if you have less than 3 supplemental labs? Well, to confirm that you do have atypical Kawasaki disease, you'll need to check an echocardiogram. Now what's an echocardiogram? Well, that's when you take a little ultrasound probe and put it on the chest and take a look at the heart. Why are we actually taking a look at the heart? In Kawasaki disease, it's a vasculitis that can actually affect the blood vessels of the heart. So getting that ultrasound of the heart is very important to make sure that the patient doesn't have more severe symptoms of Kawasaki disease. So what will you see with a heart ultrasound, also known as an echocardiogram? So let's see, what do we have in the heart? Well, first of all, we have blood vessels, which we were just talking about. We also have valves. We have the heart muscle itself, which allows the heart to contract. And lastly, around the heart, we have a thin sac that surrounds it. This is called the pericardial sac. And what is this used for? The pericardial sac is actually filled with a fluid, and this fluid that surrounds the heart actually keeps it lubricated. It's kind of like keeping a machine lubricated so that the parts don't cause too much friction and cause damage to the parts. So the pericardial sac holds this fluid that's important to keep the heart functioning without friction. So our echo will allow us to see if there's any damage to these parts of the heart. First of all, damage to blood vessel walls will cause it to weaken, and because there's too much pressure on the inside, it bulges out. This bulging of a weakened blood vessel is called an aneurysm, and an echocardiogram can pick this up. Blood vessels a lot larger in their diameter than they should be. Now remember, along with aneurysms, we have blood vessel thrombosis. What is thrombosis? Well, with damage to these blood vessels, we have clots forming. And these clots block blood from flowing forward through the heart. So without blood, heart cells and heart muscle can die. Now let me back up just for a second. Now remember that blood flows forward through valves. However, when heart valves are damaged, you can actually get backflow through the heart. This backflow is known as regurgitation, or regurgitant flow. It's essentially a sign that valves are faulty, and this can be caused by damage to blood vessels, because muscles that keep the valve working in one direction are damaged. Another abnormal finding we can see is decreased contractility, or in other words, decreased ability for the heart to pump effectively. Remember these blood vessel thromboses, or clots in the heart? The clots are preventing blood flow from getting through to some of the heart muscle. And so this heart muscle may actually die because it's not getting the blood it needs to survive. This is also known as a myocardial infarction. And so this is a very severe complication we're hoping to avoid because there's no fixing heart muscle once it's damaged. And finally, the most severe finding we can see with an echocardiogram is rupture of blood vessels. If these aneurysms get so weak that the blood vessel can no longer keep the blood in it, it will rupture and spill out of the heart. When this happens, blood will pool and collect in the pericardial sac. A collection of fluid is also known as an effusion. So you may actually hear the term pericardial effusion. That just means there's fluid that's around the heart. And in this case, the fluid is blood. So rupture is another very severe consequence of Kawasaki disease. If a patient has any of these abnormalities on echocardiogram, to prevent further complications, we need to look into the treatment of Kawasaki disease. Once you reach the diagnosis of Kawasaki disease, there are 2 treatments. By inactivating platelets that cause clots, so we decrease inflammation. Now the decrease of clot formation is extremely important because going back up here, remember we have a lot of clots being formed, and this can lead to the severe heart attack or myocardial infarction. So preventing clot formation can prevent the irreparable damage of a heart attack. And next, you want to further stop the disease process by giving IVIG. IVIG stands for intravenous, so that's just how the medication is delivered, immunoglobulins. Immunoglobulins are just antibodies, those little Y-shaped proteins that are believed to cause all this damage in Kawasaki disease. So wait a second, why am I giving more antibodies? Well, remember, the Kawasaki disease antibodies are the ones that are targeting the blood vessel. So these guys are the bad ones that are causing damage. All the rest of these ones, these green ones that I've drawn here, are fine. This is the IVIG that we're giving. So why does giving more antibodies that are not the damaging antibodies helpful in the treatment of this disease? Well, the answer to that is not quite known, but we have some ideas. The first idea is that the white blood cells and the immune system are overwhelmed by all of these other antibodies. So they spend all their time attaching to these, and these antibodies are not activated, so they're not going to cause any damage. So it prevents the white blood cells from attaching to these activated Kawasaki antibodies. Another thought is that these antibodies are directly deactivating all the bad antibodies. So maybe the good antibodies, the IVIG that you're giving, are somehow blocking the antibodies that are causing vasculitis. Another thought is that the white blood cells send so many antibodies, they say, wait a second, this is too much. And so they decrease their responsiveness and give more of an anti-immune effect. And lastly, another thought is that a large amount of antibodies increases the removal of all antibodies in the system. So this leads to clearance of all of these, the good antibodies and the bad ones. Whatever the case, IVIG is known to decrease the inflammatory effects that we see in Kawasaki disease. So it's very important to treat with these before the heart gets damaged.